Good morning, everyone. I'm Beth Reinhardt. I'm the president and CEO of the Bristol Chamber of Commerce. And I can't tell you how excited we are to be here today to share in this incredible celebration we're about to kick off. What a beautiful morning. This is example of just all the great things in our region and the beauty that we get to experience every single day here and the 4 seasons that we have demonstrated so beautifully here. And what a great place to do that here at Ballad's Bristol Regional Medical Center. I just want to say from the Chamber of Commerce, what a great opportunity it is to have partners like Ballad Health in our community, the incredible delivery of healthcare that we get to experience every single day, the great partnership that we share with their Gold Club membership and investment in the Bristol Chamber is bar none. Great partnerships always, and we know those will continue moving forward. And again, we're just excited to have the opportunity to celebrate with you all today. So with that, I want to introduce someone that's a friend of all of us, I know. Anyone that knows Eric knows what a great addition to this community that he has been and will be for years to come. But let me introduce him first and tell you a little bit about Eric Deaton, who is the Chief Operating Officer for Ballad Health. And he has oversight of the system-wide operations, which include the newly created Behavioral Services Division. He's also served as Incident Commander for the Ballad Health Corporate Emergency Center for the duration of COVID-19, leading the health system's response to the pandemic. Deaton has served in leadership roles in Tennessee, Virginia, and South Carolina for about 2 decades, providing vision and strategic thinking to help take organizations to the next level. Previously, Eric was Wellmont Health System's Executive Vice President and Chief Operating Officer. He has also held the title of Market President for LifePoint Hospitals, and there he directed the collective operations of Danville Regional Medical Center and Memorial Hospital of Martinsville, both in South Central Virginia. He has also served as President and CEO of Danville Regional from 2010 until 2013. Earlier in his career, Eric was Market Chief Executive Officer for Northside Hospital, Johnson City Specialty Hospital, and the Northeast Tennessee Rehabilitation Hospital. He earned a bachelor's degree in business administration from Milligan College, a master's degree in business administration from Bristol College, and a master of healthcare administration from the University of Cincinnati. He's a fellow in the American College of Health Executives. And again, I want to welcome our good friend and leader, Eric Deaton. Eric?
Thank you, Beth. It's great to see you. I'm sorry I'm not there with you today, but it is a beautiful day. And Beth, I'd tell you I miss seeing you like we worked together before. But thank you for all your leadership in Bristol and the great things you're doing with the Chamber of Commerce there. It's greatly appreciated. As Beth said, my name is Eric Deaton. I'm the Chief Operating Officer for Ballad Health. I really want to thank everyone who is there in person today, as well as everyone who is watching online. You know, today is something we're very excited about. We're going to unveil something very exciting. Bristol Regional Medical Center is now the home of the new J.D. Nicewonder family pediatric emergency room. I had a chance to tour the emergency area for pediatric patients a couple of weeks ago with Dr. Couch, and it is absolutely a beautiful space. We're so excited about this. This day has been a long time in the works. When the idea of Ballad Health was first sparked and came together more than 5 years ago, we started working on the merger. It began as a optimistic idea for the future, and we believed, as we do now, that through high quality care and expansion of healthcare across the Appalachian Highlands, that we can provide a high quality healthcare for everyone. Since becoming a truly and a fully formed healthcare system more than 2.5 years ago, we set our sights on really bolstering and improving the well-being of our children and their families. After all, if you think about it, really strong starts is the key for a brighter future. Almost immediately after launching the system, we announced plans to build a new pediatric emergency network throughout the system with the Niswonger Children's Hospital. Lisa Carter, who is our wonderful, fantastic Children's Hospital CEO, is there today, and we'll talk more about that in just a moment. But when we developed the system, we knew immediately that Bristol Regional would be the home of the next pediatric emergency department. The hospital, as you know, has an excellent reputation for providing high-quality health care to the people of Sullivan County and throughout Southwest Virginia. And we embrace every day the opportunity to bolster and expand services there at Bristol Regional Medical Center. So this is just another example of us expanding services. We're very excited and grateful to be able to further expand services at Bristol Regional, and so more families have access to health care really closer to home now. Today's ribbon cutting is a very special occasion, and it's really the result of the work of a lot of people. And I really want to thank and recognize the team there at Bristol Regional. There were so many people involved in this amazing event and operation, from plant operations to facility management, the emergency department, the leadership there. They have all worked tirelessly on this project, and thank you for your commitment and hard work to the children of our area. With the new pediatric ER opening its doors, we also have been very fortunate to welcome new team members to Bristol Regional. This is including a roster of child life specialists who will help ensure pediatric emergency care is really provided in a stress-free and beneficial environment for children. This emergency room area is also a joint operation of Nicewonder Children's Hospital and their pediatric experts. And will continue to be involved on a day-by-day basis, really planning, implementing, and providing support from our local children's hospital. And of course, we can't let today go and slip away without really thanking the great kindness of JD and Lorraine Nicewonder for their longstanding support of our of our region's healthcare. Thank you all so much for that. Their new namesake pediatric hospital emergency area, is the latest testament to their generosity and compassion. We are extremely grateful to them for supporting healthcare across our region. They are truly a blessing to all of us in this area. And as you can see by looking here, the J.D. Nicewonder Family Pediatric Emergency Area room really represents the best of what our health system can do and does for supporting our region. We can continue to offer amazing care and focusing on helping others and helping our families be stronger. Thank you all again very, very much for tuning in and for being there today. It's a wonderful day. We're so excited about it. And at this time, I'll introduce Dr. Chad Couch, who is the Chief Medical Officer for the Northeast region of Ballad Health, and he's also the interim president of Bristol Regional Medical Center. Dr. Couch, I'll turn it over to you.
Thank you, Eric. And I also want to add my thanks to everybody that's watching today. As Eric said, we're here today to officially open the Pediatric Emergency Department at Bristol Regional Medical Center. And I'd like to add my echo Eric's comments that this has truly been a team effort. My most sincere thanks to everyone at Bristol Regional Medical Center, Niswonger Children's Hospital, and especially the JD and Lorraine Nicewonder family for making this possible. Eric has said this is an exciting day, and it certainly is. It's even more exciting day for the children and families of Sullivan County and Southwest Virginia. The pediatric ER will change for the better the way children in our service area receive care when they're experiencing an emergency. On average, Bristol Regional sees about 500 children in our emergency department every month, and that hospital experience can be intimidating for them. But with this new pediatric emergency room, we can improve that. This new pediatric ER features a separate entrance and waiting area for families of patients, a new triage area, a new nurses station, and 4 dedicated pediatric exam rooms. Our new space is kid-friendly with bright colors and patterns. It also gives children access to child life specialists to support their care and promote normalcy during what can be a very stressful situation. This also means we welcome new team members to Bristol Regional to fill this very important role, and we're happy to have them on board. We hope that by offering a warm and compassionate setting, we'll be able to reduce some of the anxiety, not just for children that we're privileged to care for, but also for their families. So we developed this new pediatric ER with young patients first and foremost, but also taking into account parents, siblings, and grandparents who are also affected by the care. The family aspect is also why it's so important for us to develop this service locally at Bristol Regional, so families aren't separated by huge distances when one of their members needs care. With that in mind, the new J.D. Nicewonder Family Pediatric Emergency Room represents more than just a new hospital unit. It's a symbol of Bristol Regional's commitment to the children and young families of our region and of Ballad Health's commitment to this hospital. As Eric mentioned, bolstering services for children is a key component of Ballad Health's vision for the future of our region. And Bristol Regional is an integral part of that vision. We're extremely pleased to offer this new service to our communities and to continue to improve the quality of life for this region's youngest patients. I'd like to close out my remarks with a special thanks to the Ballad Health Foundation and also to the Nicewonder family for making this possible. Your support will make a world of difference to the children and families that we serve in the new pediatric ER. At this time, I'd like to introduce Lisa Carter, who's the president of Niswonger Children's Hospital and Ballad Health's vice president for pediatric service.
Thanks, Dr. Couch. It's a great day here. It's a beautiful day, and it's a great day to celebrate kids in this region and what we're able to do through the hard work of so many people. I first and foremost want to thank the J.D. Nicewonder family. You know, I had the opportunity to sit down and have some conversations with J.D. when we first started this. Not a more wonderful man who is so passionate about this region and the people of this region. You know, he shared stories, tearfully shared stories of letters he's gotten back from families thanking him for their support of healthcare. And, you know, that is absolutely what they want to do, is support this region, support the kids of this region, and offering tremendous healthcare services. So I can't say thank you enough to him and his family for their support of this project. So I've said throughout, even right after the merger, I use the analogy of a puzzle. It's like we have this puzzle where we're slowly putting the pieces in place of a network of care for kids. And so, you know, when we started, one of the very first things we did was we did a pediatric readiness assessment in all of the Ballad Health emergency departments. We wanted to make sure that every emergency department is ready if a child comes through those doors, that they have supplies and equipment that they need right there on site to take care of kids. We do that assessment annually to make sure that everyone's prepared. The second thing was to really expand the telemedicine network. And so along with that, every emergency department within the Ballad network has access to the Niswonger Children's Hospital. So if the child walks into an emergency department in any Ballad Health facility, they can link in through telemedicine to Niswonger Children's Hospital and get access to emergency medicine physicians who can help then translate that plan of care for kids. So here we are at the next phase, and we recognize that we've got areas within our community that have larger concentrations of children that need higher levels of care. So that then is why we have now the J.D. Nicewonder Family Emergency Department at Bristol Regional Medical Center, because we knew that some areas needed a higher level and a different level of care. Obviously, that puzzle is going to continue to fall into place as we build that network, working in conjunction with our Level 1 Trauma Center, working with our adult partners as we continue to expand those services throughout the region. You know, we've had with our friends over in Kingsport visioning committees to talk about that city next. Where do we move next in the lines of care and make sure that we have emergency services readily available for all children when they need it. Also, building up the services at Niswonger Children's Hospital through subspecialty care, further creating that network to provide the services that are needed for kids throughout this region. So today's a huge win for the Appalachian Highlands and for the families who live here. We're going to continue on in this journey. I can't wait to see the finished puzzle when it all comes together and the pieces are all in place and we truly have a seamless network of care for kids. So thank you all. Again, it's a great day for kids and families. So now I want to introduce Mr. Jack Simpson, who's the president of the Ballad Health Foundation.
Thank you, Lisa. As Lisa shared, my name's Jack Simpson, and I'm the president of the Ballad Health Foundation. In that role, I get the privilege of working with generous individuals and businesses throughout our region to leverage the power of private philanthropy to make strategic investments in our region's health. And today is a great example of just that. I want to thank everybody who's watching today. I want to thank everybody who made this project possible, all of the leadership that worked on it. The teams at Bristol Regional and at Nicewonder Children's Hospital, as well as the Ballad Health leaders and administrators who envisioned and pursued this pediatric emergency department, have made an incredible advancement for children's health care throughout the Appalachian Highlands region. Their work is supported through the generous philanthropic support of the Nicewonder family. So that's why today, as a part of this ribbon cutting ceremony, we're delighted to unveil the name of the Pediatric Emergency Department, the J.D. Nicewonder Family Pediatric Emergency Department. This department's namesake, J.D. Niswonger, along with his wife, Lorraine, are longtime supporters of health in our region. And with this generous gift, we are immeasurably grateful to them. The family's long championed healthcare in the region, and their investment in children's health services here is a testament to that, and a testament to their commitment to transforming local life and health. Their gift is also a vote of confidence and optimism in this hospital, in Bristol Regional Hospital, and its future, as well as a sign of appreciation for our hospital that's undoubtedly echoed by thousands of lives that have been and will continue to be touched throughout this hospital each year. They have a long heritage with us. In 2005, leaders at Bristol Regional first honored this amazing family by christening the cancer center the J.D. and Lorraine Nicewonder Cancer Center. The family's gifts at that point had enabled the hospital to become one of the first facilities in the nation to acquire a cyber knife stereotactic radiosurgery. That system, which is one of the most leading edge cancer treatment technologies available, has helped innumerable people in our region receive the best possible cancer care right here close to home. And in another 15 years, I'm confident that we will look back on this pediatric emergency department and recognize how many children received life-saving treatment here, and their families were able to access that in a convenient setting. J.D. and Lorraine Nicewonder's generosity and foresight have made enormous advancements in healthcare in the Appalachian Highlands, and they're making a substantial difference in all of our lives. So we cannot thank them enough for making the dream of this emergency department a reality. I'd like to thank everybody for watching today. I'd like to thank our team members for their commitment to and hard work and for being here today. And I think that it is probably fitting that we go on ahead and cut the ribbon. So if you all want to move into place, we'll proceed with that.
For those viewers online, we're going to play a quick video for you to enjoy. Thank you for being here today.
Thank you, guys. Yeah, thank you for coming out. That was awesome.
We're very excited to announce the opening of the Pediatric Emergency Department here at Bristol Regional Medical Center. There is a dedicated entrance, dedicated exam rooms, dedicated nursing stations. It's a space that's specifically designed for children.
In that environment, you can expect to see some of the finishes that are similar to what is here at Niswonger Children's Hospital. Child-friendly colors, there's a lot of animal patterns, a true pediatric-friendly emergency environment.
The exam rooms are the right size, the equipment is made for them. We have a staff that is completely dedicated to the care of pediatric patients.
We're very excited and appreciative of Ballad for helping to arrange for this in our community and having this pediatric expertise added to Bristol. We have the benefit of providers who have trained at various children's facilities, including Niswongers, to have that expertise offered to our community.
We have teleconnections between the Bristol Emergency Department and our Niswonger Children's Hospital Emergency Department, where the physicians and staff can link directly into the physicians here. We will have a child life specialist that's dedicated to that department, and what that specialist does really is to provide a whole different level of child-friendly services. They really help kids cope through painful procedures. They use medical play to help educate and teach. They work with parents in difficult situations to help them cope.
By utilizing play and reassurance and comfort techniques with children, they're able to walk through difficult or uncomfortable situations in a visit to the emergency department in a way that makes that child feel safe and in control. And so by doing that, it makes it a less anxious experience for the child and allows us to deliver care in a comfortable setting.
We're very thankful to the J.D. Nicewonder family for their very generous donation that allowed this to happen and gave us an opportunity to provide a specific emergency department for children in our region. Ballad Health is committed to the health of our region, and this is an example of the value that Ballad Health is bringing by opening this pediatric emergency department here at Bristol Regional.
Once again, thank you all for those that have tuned in on Facebook Live and on Zoom to celebrate with us today. On behalf of the Bristol Chamber and the entire business community, we thank all of you all for participating, and congratulations to Ballad Health, entire community and residents for this great addition. Thanks for joining in.